Every day, thousands of people wake up believing they're perfectly healthy, completely unaware that one of the most vital organs in their body is slowly losing its ability to function. The frightening truth is that kidney disease rarely announces itself with dramatic warning signs. Instead, it works silently, often progressing for years before a routine medical test finally reveals the damage. By then, a significant portion of kidney function may already be gone. What makes this even more alarming is that nearly 90% of people living with chronic kidney disease don't realize they have it. They continue with their normal routines, dismissing subtle changes in their body as signs of aging, stress, or fatigue. But your body has been trying to send you messages all along. The clues may appear in places you'd never expect: your skin, your nails, your urine, even the way you breathe. In this video, we're going to uncover 17 warning signs that could indicate your kidneys are struggling long before standard lab tests expose the problem. Recognizing these signals early can make a tremendous difference, giving you the opportunity to protect your kidneys while there's still time. Before diving into those warning signs, it's important to understand what your kidneys actually do. Most people think of them as simple filters that remove waste from the blood and create urine. While that's true, it only scratches the surface of their responsibilities. Your kidneys constantly maintain the balance of minerals like sodium and potassium, helping your nerves communicate and your muscles, including your heart, function properly. They regulate your body's acid levels, produce hormones that stimulate red blood cell production, strengthen your bones, and play a major role in controlling blood pressure. In many ways, they serve as the body's silent control center. Because the kidneys influence so many different systems, the signs of kidney disease can appear almost anywhere in the body. That's why many people never connect these symptoms back to their kidneys. One of the earliest and most overlooked signs is persistent foamy urine. Everyone notices bubbles in the toilet from time to time, and that's usually nothing to worry about. But there's a major difference between ordinary bubbles that disappear within seconds and thick, creamy foam that remains on the surface long after you've flushed. If your urine consistently develops a dense layer of foam resembling the froth on top of a freshly poured beer, your body could be revealing something important. This often happens because a protein called albumin is escaping into your urine. Under normal circumstances, albumin should remain inside your bloodstream. Healthy kidneys contain millions of microscopic filtering units designed with incredible precision. These tiny filters allow waste products and excess water to pass through while keeping valuable substances like proteins safely inside the blood. When those filters become damaged, however, small gaps begin to form. Albumin slips through these openings and mixes with your urine. Because this protein behaves similarly to soap, it creates the thick foam many people notice. The most concerning part is that this leakage usually occurs long before pain or other obvious symptoms appear. You might feel perfectly healthy while your kidneys are already under stress. Fortunately, detecting this problem is simple. A basic urine test can identify albumin long before kidney damage becomes severe. It's inexpensive, quick, and often provides doctors with one of the earliest clues that something isn't functioning as it should. Another warning sign often follows this protein loss: swelling. Try a simple test on yourself. Press your thumb firmly against the front of your lower leg for several seconds, then release it. If the skin remains indented instead of bouncing back immediately, doctors refer to this as pitting edema. This happens because albumin doesn't just stay in your blood for transportation. It also helps keep fluid inside your blood vessels. As albumin levels fall due to leakage into the urine, water begins escaping into nearby tissues. Gravity pulls that extra fluid downward, making the ankles, feet, and lower legs the first places where swelling usually becomes noticeable. Some people also wake up with swollen eyelids or puffy faces, assuming they simply didn't sleep well. In reality, their kidneys may already be struggling to maintain proper fluid balance. And this is only the beginning. As kidney function continues to decline, the body starts triggering a chain reaction that affects nearly every organ system. One of the next warning signs often appears while you're asleep, and most people never realize what it's trying to tell them. If you find yourself waking up several times every night just to use the bathroom, don't be too quick to blame aging or drinking too much water before bed. While those factors can certainly play a role, frequent nighttime urination can also be one of the earliest signs that your kidneys are losing one of their most important abilities. Healthy kidneys don't simply produce urine all day at the same rate. While you sleep, they respond to signals from a hormone that tells them to conserve water. Instead of making large amounts of urine, they produce a smaller volume that is much more concentrated. This allows most people to sleep through the night without interruption. But when kidney function begins to decline, This delicate system starts breaking down. The kidneys gradually lose their ability to concentrate urine. Instead of holding onto water overnight, they produce larger amounts of diluted urine. As a result, your bladder fills more quickly, forcing you to wake up repeatedly. For many older adults, getting up once during the night, and sometimes twice, is considered fairly normal. However, if you're consistently making 3, 4, or even 5 trips to the bathroom every night without any obvious explanation, your kidneys may be signaling that something isn't right. Sleep disruption doesn't just leave you tired the next morning. Over time, poor quality sleep affects memory, blood pressure, heart health, immune function, and overall energy levels. What starts as a nighttime inconvenience can gradually impact nearly every part of your daily life. Another surprising place where your kidneys may reveal trouble is right at your fingertips. Most people rarely examine their fingernails closely, yet doctors often do because they can reveal important information about what's happening inside the body. Healthy nails usually display a consistent pink color with a small pale crescent near the base called the lunula. But in people living with long-term kidney disease, the appearance of the nails can change dramatically. Instead of a smooth, even color, the lower portion of the nail may become pale or white, while the upper half develops a darker reddish-brown shade. Doctors refer to this as half and half nails. Not every kidney patient develops this change, and having it doesn't automatically mean kidney disease is present. However, decades of medical observations have shown a clear connection between this unusual nail pattern and chronic kidney problems. It's another reminder that your body often sends subtle warnings long before serious symptoms appear. As kidney function continues to decline, another silent problem begins developing inside the bloodstream, one involving a mineral your body needs every single day. That mineral is phosphorus. Phosphorus is naturally found in foods like dairy products, meat, nuts, beans, and fish. It's also added to countless processed foods, packaged snacks, fast food meals, and soft drinks. Normally, healthy kidneys remove excess phosphorus without difficulty. Damaged kidneys, however, slowly lose that ability. As phosphorus starts building up in the bloodstream, it begins binding tightly with calcium. Together, these two minerals form tiny crystals known as calcium phosphate. At first, these crystals are invisible. But over time, they can settle in places where they absolutely don't belong. Some of them accumulate just beneath the skin, forming small, firm lumps that may feel like tiny pebbles under the surface. They're usually painless in the beginning, causing many people to ignore them completely. In more advanced cases, these deposits may eventually break through the skin, releasing a chalky white substance. While uncommon, it's a clear indication that the body's mineral balance has been severely disrupted. Unfortunately, the skin isn't the only place these crystals can collect. An even greater danger occurs when calcium phosphate begins building up inside blood vessels. Healthy arteries are soft and flexible. They expand and contract with every heartbeat, helping blood flow smoothly throughout the body. But after years of excess phosphorus circulating through the bloodstream, those artery walls begin undergoing a remarkable and dangerous transformation. Instead of behaving like flexible blood vessels, the cells inside the artery walls start acting almost like bone-forming cells. They gradually deposit calcium into the vessel walls, causing the arteries to harden. As flexibility disappears, the heart must pump much harder to move blood throughout the body. This increased workload dramatically raises the risk of heart attacks, strokes, poor circulation, and heart failure. Some doctors can even feel this change during a physical examination. Certain arteries become unusually firm beneath the skin, almost resembling tight cords instead of soft blood vessels. Thankfully, your body doesn't simply allow phosphorus to rise without trying to fight back. It releases a specialized hormone designed to reduce phosphorus levels by encouraging the kidneys to eliminate more of it while decreasing how much your intestines absorb from food. For a while, this emergency response works, but it creates an entirely new problem. As phosphorus control improves temporarily, calcium levels begin falling. And that's when many people start experiencing one of the most painful symptoms associated with early kidney disease: severe muscle cramps. These aren't the mild cramps you might get after exercising. These are sudden, intense spasms that often strike without warning, especially during the night. Many people are jolted awake by a calf muscle that tightens so forcefully it feels almost impossible to relax. Night after night, those painful muscle cramps may seem like nothing more than an annoying interruption to your sleep. Many people blame dehydration, aging, or simply overusing their muscle during the day. But when your kidneys are struggling, those cramps can be the beginning of a much larger problem, one that slowly weakens your entire skeleton without you realizing it. As phosphorus continues to build up in the bloodstream, calcium levels gradually fall. Your body treats this as an emergency because calcium is essential for your muscles, nerves, and heart to function properly. To correct the imbalance, 4 tiny glands located behind your thyroid, the parathyroid glands, step in. These glands release a hormone whose mission is simple: restore calcium levels by taking calcium from the place where your body stores it most abundantly, your bones. At first, this solution works perfectly. Blood calcium returns to a safe level, allowing vital organs to continue functioning normally. But the price is enormous. Day after day, month after month, your bones quietly surrender more and more of their mineral content. They become thinner, weaker, and far more fragile than they should be. Most people don't notice anything unusual until the damage has already become significant. One of the earliest clues is something many dismiss as a normal part of getting older: losing height. Have you ever heard someone say they used to be 2 or 3 inches taller than they are today? That change isn't simply posture. Very often, it's the result of tiny compression fractures occurring inside the bones of the spine. As weakened vertebrae slowly collapse under the weight they support every day, the spine shortens little by little. Another warning sign is breaking a bone after what should have been a harmless fall. A healthy skeleton is remarkably strong. Falling from a standing position onto a flat surface shouldn't normally result in a fractured hip, wrist, or spine. When it does, doctors immediately begin looking for an underlying cause, and chronic kidney disease is one possibility that should never be overlooked. But weakening bones are only part of the story. As kidney function declines further, waste products that should normally leave the body through urine begin accumulating inside the bloodstream. Doctors call this condition uremia. Think of it as the body slowly becoming overwhelmed by toxins it can no longer eliminate efficiently. These toxins don't stay in one place. They circulate everywhere. They reach the skin, the nerves, the muscles, the digestive system, and even the brain. One of the first symptoms many people experience is relentless itching. This isn't the occasional itch caused by dry skin or an insect bite. It's an intense, persistent itching that seems to involve the entire body. What's especially frustrating is that scratching provides almost no relief. People often spend weeks trying new soaps, allergy medications, expensive creams, or prescription lotions with little success because the problem isn't actually starting in the skin. The toxins circulating through the bloodstream begin irritating tiny nerve endings beneath the skin's surface. Over time, those nerves become overly sensitive. Even the light touch of clothing, slight warmth under a blanket, or a small change in temperature can trigger another wave of unbearable itching. As the condition progresses, the brain itself begins amplifying these signals. Eventually, the urge to scratch becomes almost constant. Many people scratch so aggressively that they leave marks, cuts, and scabs across their arms, legs, and back without ever finding lasting relief. The worst part? This symptom often becomes most intense at night. Instead of sleeping peacefully, people spend hours tossing, turning, and scratching. Even when exhaustion finally wins, another problem frequently takes its place: an overwhelming urge to move the legs. This condition is known as Restless Leg Syndrome. Imagine lying comfortably in bed, ready to fall asleep, when suddenly your legs feel impossible to keep still. It's difficult to describe. Some people compare it to crawling sensations beneath the skin. Others describe tingling, pulling, burning, or deep discomfort inside the muscles. Whatever the feeling, one thing becomes impossible. You simply cannot stop moving your legs. You stretch them. You shake them. You rub them together. Sometimes you even get out of bed and walk around the room just to calm the sensation. The moment you lie down again, it returns. Researchers believe one important reason involves iron. Your brain depends on iron to produce dopamine, a chemical messenger responsible for controlling smooth muscle movement. When kidney disease creates ongoing inflammation throughout the body, another hormone begins trapping iron inside storage tissues instead of allowing it to circulate where it's needed. Even if the body technically contains enough iron overall, the brain can't access it efficiently. The result is disrupted dopamine activity, and restless legs become a nightly battle. Unfortunately, constant itching combined with restless legs creates the perfect recipe for chronic sleep deprivation. Night after night, quality sleep becomes almost impossible. The body never fully recovers. Energy begins disappearing. Concentration declines. mood changes become noticeable. Many people assume stress or aging is responsible, never realizing their kidneys may actually be driving the entire process. Then something even stranger begins happening. Foods you once loved suddenly lose their appeal. Meals no longer taste the way they used to. Some people describe an unpleasant metallic flavor that refuses to go away, almost as if they've been holding coins inside their mouth. It seems like a completely unrelated symptom. Yet it's another powerful clue that waste products are continuing to build inside the body. That strange metallic taste in your mouth may seem like a dental problem, a side effect of medication, or something you ate earlier in the day. But if your kidneys are no longer removing waste efficiently, the explanation may be far more serious. When kidney function declines, waste products that should leave through urine begin circulating throughout the bloodstream. Some of these compounds eventually find their way into your saliva. Once there, the naturally occurring bacteria inside your mouth break them down into chemicals with an unpleasant taste and odor. The result is a persistent metallic flavor that refuses to disappear. Many people describe it as tasting pennies, iron, or old metal every time they eat. Even foods they once enjoyed suddenly become unappetizing. At the same time, family members may notice something unusual about their breath. It's not typical bad breath caused by poor oral hygiene. Instead, it carries a distinct ammonia-like odor that experienced healthcare professionals immediately recognize as a possible sign of advanced kidney dysfunction. Naturally, when everything tastes unpleasant, eating becomes less enjoyable. But the problem doesn't stop with your taste buds. The toxins circulating through your bloodstream begin affecting the brain itself. Deep inside the brain is a small control center responsible for protecting you from poisoning. Whenever dangerous substances enter the body, this area sends out emergency signals designed to stop you from eating anything else. If necessary, it even triggers nausea and vomiting to remove harmful substances already inside the stomach. Normally, this survival mechanism protects us from contaminated food. But when kidney disease allows toxins to accumulate day after day, this same protective system becomes confused. Your brain begins behaving as though you're constantly being poisoned. Appetite gradually disappears. Meals become smaller. Favorite foods lose their appeal. Many people develop an especially strong dislike for meat because protein-rich foods become increasingly difficult to tolerate. Eventually, unexplained weight loss begins. No new diet. No increase in exercise. The pounds simply continue disappearing. If someone close to you has been steadily losing weight, feeling nauseated for weeks, avoiding meals, and becoming noticeably weaker without an obvious explanation, kidney disease deserves serious consideration. But the toxins don't stop affecting appetite. They also interfere with one of your body's most important emergency repair systems. Think about the last time you bumped into the corner of a table or accidentally hit your arm against a doorway. Normally, tiny blood cells called platelets rush to the injured area and quickly form a seal, stopping bleeding before it becomes noticeable. In chronic kidney disease, however, those platelets become far less effective. The toxins circulating in the blood interfere with their ability to stick together. As a result, even very small injuries may leave surprisingly large bruises. Some bruises seem to appear without any remembered injury at all. Others spread much farther beneath the skin than expected. You might also notice your gums bleeding every time you brush your teeth. Nosebleeds may become more frequent. Small cuts seem to take much longer to stop bleeding than they once did. Each symptom may appear insignificant on its own. Together, they paint a picture that doctors recognize immediately. Fortunately, there's one symptom that has become extremely rare thanks to modern medical care, but it's worth understanding because of what it represents. In severe, untreated kidney failure, waste products can reach extraordinarily high levels. When this happens, sweat itself begins carrying large amounts of these substances to the surface of the skin. As the moisture evaporates, tiny white crystals remain behind, creating what looks like a fine layer of white powder dusting the body. Doctors call this uremic frost. Thankfully, this is rarely seen today because dialysis usually prevents waste levels from reaching that extreme. However, if it does appear, it signals a medical emergency requiring immediate treatment. Another life-threatening complication can develop around one of the body's most important organs. Your heart is surrounded by a thin protective sac called the pericardium. When kidney toxins begin irritating this delicate membrane, inflammation develops. Unlike a sore muscle that can rest while it heals, the heart never gets a break. It continues beating every second of every day, constantly rubbing against the inflamed tissue surrounding it. The pain is often sharp and stabbing. It usually becomes worse during deep breaths or when changing body position. Sometimes doctors can even hear the inflamed layers rubbing together through a stethoscope. This condition requires urgent medical attention because delaying treatment can become life-threatening. Yet despite all these serious complications, there's one symptom that affects kidney patients more consistently than almost any other: overwhelming fatigue. Not the kind that disappears after a good night's sleep. This is a deep exhaustion that follows you from morning until bedtime. Simple daily activities suddenly feel unusually difficult. Walking upstairs leaves you breathless. Carrying groceries feels exhausting. Even getting dressed may seem like more effort than it used to. Part of this fatigue comes from poor sleep caused by itching, muscle cramps, and restless legs. Part comes from toxins circulating throughout the body. But another major reason is something many people have never heard of: a hormone your kidneys quietly produce every single day. When healthy kidneys begin failing, production of this hormone drops dramatically. Without it, your body gradually stops making enough red blood cells. As oxygen levels throughout the body begin falling, every organ starts working harder just to perform ordinary tasks. Imagine feeling completely healthy while one of the most important organs in your body is quietly losing its ability to keep you alive. As unsettling as that sounds, it's exactly what happens to millions of people every year. And now we arrive at perhaps the most dangerous warning sign of kidney disease. Not because it's dramatic, but because it often goes completely unnoticed. Before we get there, let's finish the story behind the crushing fatigue that so many kidney patients experience. Your kidneys do far more than remove waste. They also produce a vital hormone called erythropoietin, often shortened to EPO. This hormone sends a simple but incredibly important message to your bone marrow: produce more red blood cells. Red blood cells are your body's oxygen delivery system. Every heartbeat sends them throughout your body, carrying oxygen to your muscles, your brain, your heart, and every organ that depends on it to survive. When healthy kidneys begin to fail, they produce less and less EPO. Without enough of this hormone, your bone marrow slows down the production of red blood cells. Gradually, anemia develops. Unlike sudden blood loss, this happens so slowly that many people don't realize what's occurring. They simply notice that everything feels harder than it used to. Walking upstairs leaves them breathing heavily. Carrying groceries becomes exhausting. Household chores take twice as long. Even after sleeping through the night, they wake up feeling completely drained. Friends and family may assume they're simply getting older. Some even blame stress or depression. But the real issue is that every cell in the body is receiving less oxygen than it needs. The encouraging news is that this particular complication is often treatable. Doctors can prescribe synthetic versions of erythropoietin that stimulate red blood cell production once again. Combined with proper treatment of the underlying kidney disease, many patients experience a remarkable improvement in energy, endurance, and overall quality of life. But now we come to the final warning sign. Ironically, it's the absence of symptoms. Chronic kidney disease progresses through 5 different stages. During the earliest stages, the kidneys compensate so well that most people notice absolutely nothing unusual. No pain, no discomfort, no obvious illness. Life continues exactly as before, while kidney function slowly declines in the background. Only after a significant amount of damage has already occurred do symptoms like swelling, fatigue, itching, nighttime urination, and appetite loss begin appearing. That's why chronic kidney disease is often called a silent disease. It hides in plain sight. Many people only discover it during routine blood work ordered for an entirely different reason. A simple blood test reveals elevated creatinine. A urine test detects protein leakage. Suddenly, a diagnosis appears that may have been developing quietly for years. This is precisely why regular screening matters so much, especially for people who already have risk factors. 2 conditions are responsible for the majority of chronic kidney disease worldwide. The first is diabetes. High blood sugar slowly damages the tiny filtering units inside the kidneys, reducing their ability to clean the blood efficiently. The second is high blood pressure. Every heartbeat pushes blood through delicate kidney vessels. When blood pressure remains elevated for years, those fragile vessels gradually become damaged under the constant mechanical stress. If either diabetes or hypertension runs in your family, or if you've already been diagnosed with one of them, routine kidney testing shouldn't be optional. A simple creatinine blood test, an estimated glomerular filtration rate, eGFR, and a urine test that checks for albumin can reveal kidney problems long before severe symptoms develop. These tests are widely available, relatively inexpensive, and often provide life-saving information. There's another risk factor many people overlook completely: painkillers. Millions of people regularly take medications like ibuprofen, naproxen, and other non-steroidal anti-inflammatory drugs for headaches, arthritis, back pain, or joint discomfort. Because they're sold without a prescription, it's easy to assume they're harmless. But frequent, long-term use tells a different story. These medications reduce blood flow inside the kidneys. Over months or years, repeated exposure can contribute to both sudden kidney injury and gradual chronic damage. This doesn't mean they should never be used. It simply means they should be taken responsibly and only when truly necessary. If you rely on these medications regularly, it's worth discussing kidney monitoring with your healthcare provider. Age itself also deserves attention. Beginning around age 40, kidney filtration naturally declines by roughly 1% each year. This doesn't mean kidney disease is inevitable. It simply means that as the decades pass, protecting kidney health becomes increasingly important. Staying well hydrated, managing blood pressure, controlling blood sugar, maintaining a healthy weight, avoiding unnecessary medications, exercising regularly, and keeping routine medical appointments all help preserve kidney function for years to come. Now think back over everything we've covered. Persistent foamy urine, swelling in the ankles, legs, or around the eyes, frequent nighttime urination, changes in your fingernails, painful nighttime muscle cramps, persistent itching, restless legs, metallic taste, loss of appetite, unexpected weight loss, easy bruising, constant fatigue. Each symptom alone may have many possible causes. But when several begin appearing together, they deserve attention. Not fear, but attention. Your body has an incredible ability to warn you when something isn't right. The key is recognizing those warnings before irreversible damage occurs. Kidney disease doesn't usually arrive overnight. It develops quietly, patiently, and often without pain. But early detection changes everything. The sooner it's found, the greater the opportunity to slow its progression, preserve kidney function, and avoid complications that could eventually require dialysis or even a kidney transplant. Remember, this information is designed to help you recognize potential warning signs and ask better questions, not to replace professional medical advice. If any of these symptoms sound familiar, or you're living with diabetes, high blood pressure, or other kidney risk factors, schedule a conversation with your healthcare provider and request a simple kidney evaluation. Taking action today could protect your health for many years to come. If you found this video valuable, make sure to subscribe to the channel, give this video a thumbs up, and share it with someone who might need this information. Your support helps us continue creating clear, reliable health content that empowers more people to recognize hidden warning signs before it's too late. And before you go, leave a comment below telling us your age and whether any of these symptoms surprised you. We'd love to hear from you. Stay healthy, stay informed, and we'll see you in the next video.